Wonderful. So it is 10 a.m. Let's go ahead and get started. See if I can figure this out. Well, good morning, everyone. It is truly wonderful to see so many of our staff, advisory board members joining us this morning as we wrap up our webinar series. To everyone who participated throughout the year, I want to say thank you, thank you. I hope that you found our sessions as engaging and as inspiring as I did. These webinars have been an incredible way to stay connected, share updates, and celebrate the many exciting projects happening across our organization. And I am filled with immense pride and gratitude for being part of such a remarkable team. Your dedication, your resilience, and heart are the driving forces behind our success, and I am profoundly grateful for each of you. Each of you have played such an essential role in advancing our mission and vision, and together we have accomplished so much this year. So Laura, take me to the next slide, please. So as we approach the end of the year, which is so hard to believe, this year just simply flew by, I want to take a moment to reflect on all that we have accomplished together. This has been a year of transformation and growth for Catholic Community Services. It's been marked by change, progress, and a renewed sense of purpose. One of the most significant shifts this year has been our embrace of a unified perspective. We are no longer thinking of ourselves as a separate agency or separate agencies, but rather as one cohesive organization, bound by our shared mission to serve those in need across the diocese and across the church. United as one, we are stronger, working hand in hand with our communities and with our parishes to expand our reach and our impact. Next slide, please. So there's no doubt that we have grown. And as I mentioned before, we have certainly changed. Our teams have grown significantly, and we have thoughtfully restructured our organization to align with our strategic initiatives and our long-term vision. So this deliberate approach ensures that we are well positioned to meet the evolving needs of our communities and everyone that we serve. We are thrilled to welcome several key leaders who bring a wealth of experience and expertise to their roles. Terry Randolph has joined our new Chief Operating Officer, Heather Karp as our Executive Director of Human Resources, Terrence Watkins as Executive Director of Housing, Kristen Matthew as Executive Director of Clinical Services. Their leadership and fresh perspectives are already making a tangible impact as we enhance and expand our housing programs, as well as our behavioral health programs, ensuring that these services remain robust, innovative, and accessible. As part of this growth, we have created a new senior leadership position, the Executive Director of Children and Family Services, and we are delighted to have George Rushing step into this critical role. He's brought exceptional leadership to our Pio Decimo Center, child welfare programs, immigration, refugee services, nutrition services for the elderly here in Tucson. George's extensive experience and background in child welfare and behavioral health services for families and children has positioned him perfectly to guide us and guide these programs into the future with innovation and with compassion. Our renewed emphasis on compliance and quality improvement has led to the establishment of another vital role filled by Evita Mendez-Counts. Evita now leads the development and implementation of organization-wide initiatives. These systems are designed to track and manage risk, quality, and outcomes, ensuring that we uphold the highest standards of compliance and operational excellence. Evita's work will support all areas of our organization, empowering teams to deliver consistent and measurable results. We hired Kim Trevino as our grant coordinator. We created a new position, marketing director. Catherine Thurston joined us as well in this key position. Clay Cummins, another key role for our organization, another new position created, executive director of IT. These organizational enhancements reflect our dedication to advancing our mission, embracing change, and staying ahead of challenges. So together we are building a stronger, more resilient organization to better serve the individuals and families who rely on us. Laura, next slide, please. So our commitment to addressing the growing issue of homelessness has been the cornerstone of our work this year. With the collective efforts of our team, we're expanding housing options and creating innovative solutions to support individuals and families. Our focus includes developing a comprehensive housing continuum of care, which includes medical respite, transitional housing, and permanent supportive housing to provide holistic and sustainable solutions. With Terrence's leadership, we were successful in securing a contract to serve as the local coalition to end homelessness for Santa Cruz, Cochise, Graham, and Greenlee counties. We were also awarded a new contract to provide HUD housing services. This allows us to provide additional housing supports for individuals leaving medical respite program. We achieved spend down on BESO's Day One funding to include and provide expansion of transitional housing, eviction prevention, homeless diversion services to over 100 families in Pima, Yuma, Cochise, Santa Cruz, Graham, and Greenlee counties. And we started another innovative program in Sierra Vista with a tiny community of tiny homes. At the same time, we are laying the groundwork for comprehensive behavioral health programs across Catholic Community Services. This initiative is designed not as a standalone program, but as a strategic enhancement that is meant to be integrated into the fabric of who we are as an organization. By embedding these services across our diverse programs, we will better address the needs of individuals and families while we strengthen the impact of our work. So we have taken meaningful steps to assess the life cycle of our programs, thoughtfully deciding which ones to sunset and which ones to reshape to better meet the needs of those we serve. This deliberate approach and process has allowed us to refocus and channel our resources toward programs that align with the greatest needs of our communities today. And I'm going to introduce to you Julie Jackson, our interim CFO, who will highlight these successes and the impact that these changes have made financially to our organization. Julie?
Thank you, Elena. I'm not sure how well I'm going to do with this. My voice keeps coming and going. If you can move to the next slide. Thanks. So I'm really only going to focus on a few programs, and this really came about as a result of the review of the financials through October 31st. So I'm not going to address all programs, but I wanted to point out a few of the successes that I shared with the board of directors. So as Elena mentioned, we're moving away from agencies and classifying by programs. So the Child and Family Services umbrella of programs includes child welfare, Pio Decimo, assets, MRS, immigration, and Casalitas. Together, these programs make up Child and Family Services, and this group of programs has a surplus for the first 4 months of fiscal 25. The surplus is being led by George Rushing's team in child welfare. Arizona Families First and Kinship are both far exceeding budget expectations due to the productivity of their team members. Looking over prior fiscal years, child welfare experienced significant losses for many years. And through George's leadership and the commitment of his team, Lily and Sophia, all the direct care service providers, the whole team, they're providing services and implementing and having an understanding of the productivity standards for a stable, sustainable program. And that's what Elena's talking about, these programmatic changes. So I wanted to highlight that one over the course of this year and how it stands different from prior fiscal years. So great job, team in child welfare. Pio Decimo, I'd like to also, this is another program that I brought up recently at the board meeting. After learning of the loss of funding from a funding source, the team at Pio Decimo reached out to United Way and secured additional funding from United Way to help fill that gap left by the other funding source. So having that awareness of the importance of sustainability is another great example of George's team really pivoting and having an awareness of not just the program initiative, but also the sustainability. So great job there. The last one that I highlighted at the recent board meeting was CLP Community Living Program. Community Living Program lives under the housing umbrella. And this is another program that has struggled both financially and staffing for a long time. And sorry about that. So despite significant vacancies, Community Living, CLP, is operating at break even through October. And what a wonderful accomplishment that is for the team who's there. They are shorthanded and consistently shorthanded. So I just wanted to point out that before corporate management fee, CLP is operating at break even despite all of their shortages. So great job managing through that. The last item on here, number 3, is revenue diversification through Medicaid funding. Elena spoke about that in detail, and I know Terry is going to also speak about it, and you'll probably be able to understand them a lot better than me today. So I won't go into a lot of detail about that, but I will say that diversification of revenue, whether it's through Medicaid or any other source, like acts as a way to lower risk. And so minimizing risk is always desirable, but diversification through Medicaid, you will hear a lot about the initiatives that are underway and that will progress through the coming months. And the way that finance and the finance team will support that is through centralized billing. And I'll talk about that a little later in the presentation. But while the teams are providing support and providing the services to those in the community, the finance team will be providing support through the centralized billing over the second half of the year and on forward. So the impact, you'll continue to see the impact of the Medicaid billing and the diversification. So stay tuned for more on that. Sorry about that. I'm not sure. Can you go to the next slide? There we go. I'm not sure who has this slide.
I do, Julie. Well, thank you, everyone. So thanks, Julie, for running us through from a finance perspective. We wanted to also have an opportunity to highlight the foundational impacts of our strategic plan, which also includes many of the pieces that Julie was just speaking about. But on a broader level, kind of to bring this back to how our foundational year this year has been directly tied to our strategic initiatives. For many of you who had an opportunity to review the strategic plan and see that throughout the year being implemented, our 4 core foundational areas of focus for this year were everything from people development, process development, program enablement, and centralized support. So many of the things that Julie highlighted from a finance perspective, you can see are directly tied to our strategic initiatives. I think that you'll see that as a theme throughout today's webinar. So Laura, if you could go to the next slide. So thinking about those 4 core areas, we wanted to give a few key highlights and successes of the year that you'll see that are the output of our dedication to that strategic plan as an organization. So first, when we think about people development, some of the way that came to life this year is those bi-monthly manager meetings that have been in great attendance, and with the support of Heather Karp and HR, really putting those together and keeping us as a unified team on alternating months, those HR training. So that's another showing of our commitment to people development. And then also these webinars themselves were part of that strategic plan and really working to bring our programs and our team together so that we have that unified vision of where we're headed. We have a collective understanding of what's happening in programs, all so that we can best support our mission and continue to support our community as one core agency. Some other highlights from a process development. We have early implementation of Unite Us, which is our referral platform within the community. We have that live in Tucson. It has been live in Yuma. We're continuing that implementation throughout the next year, so you'll hear a little bit more about that coming into 2025, but we're really proud of the technology setup and working with Clay Cummings and getting that technology set up so that we can continue again to serve our mission. So we're really proud of having that implementation rolling in this last year. Program enablement, that's been really focused on not only the financial sustainability of our programs, but a lot of the efforts that Julie also spoke about, specifically when you see examples like child welfare, really having an opportunity to look at what do our programs need to continue to effectively serve the community, as well as how do we get that information out to those who need our services. And so from a program enablement standpoint, our strategic efforts aligned with that are reflected in the refined organizational structure that Elena spoke about. That was a key initiative early in the year to really look at how do we align our organization with where we want to head in the future. Another example of our strategic initiatives around program enablement is the refined elevator speech, which is really a smaller term for a very larger initiative on looking at how do we talk about our programs, both internally and externally, and how do we have that be clear and concise in a way that we can really draw on those individuals and connect with those who need our services the most. And we've been actively working as an organization on the strategy for refreshing the website to reflect not only that refined, concise view of our programs, but again, making sure that it is the most useful tool. So you'll see a lot more traction in 25 as that implementation happens. And then lastly, a highlight under program enablement, the behavioral health launch and the focus on that program was a key initiative of the strategic plan. And so that coming to life has been a moment that we should all be really proud of and continue to see progress. And then lastly, but definitely not least, is our efforts from a strategic perspective on centralized support. That's really about how can the business office best support operations and continue to allow programs to focus on serving our mission and our community. So those program and financial assessments that Julie spoke about is a direct reflection of that, as well as the ongoing efforts for centralizing our billing efforts. Again, that is a piece that will continue to be ongoing in 2025, along with all of these. Knowing that this is our foundational year, we'll see a lot of implementation happening in the next year. And then another example is from compliance, specifically the corporate compliance training and all of the work from Avita and team from a programmatic perspective, looking at compliance as a organizational wide initiative was a large piece of our strategic initiatives. We're really proud as an organization of this team across managers and at all levels, the commitment to our strategic plan this year. And I think that looking at these just key highlights, these are very high level. There's so much work that has been happening behind the scenes from work groups and at the program level. So we want to say thank you for everyone for your continued support here. Laura, we can go to the next slide. I think as we transition and thinking about where we go from this year, which we've considered our foundational year, really setting the stage for success moving forward, and how this rolls into 2025. And so when we think about the strategic plan, it is a transition from our foundational year to our implementation year. While early implementation has definitely happened in 2024, we're really excited to be bringing this all, into action in 25. So as the strategic plan is being finalized for this next year, you'll see many of the same initiatives with different focus on how do we tie this to outcomes? How are we taking action with the data that we're starting to collect? All at core to keep our mission top of mind and best serve our community. So a lot of that you will continue to hear more information as we get into January. But at this point, I'll pass it over to Terry and we can talk a little bit more about what to expect in the next year.
Thank you. I'm Terry Randa, for those of you I have not met. It's been a wonderful first 3 months here, and it's all been very exciting. I get the opportunity right now to tell you about how we're going to move forward with 2025. All of the things that we've talked to up to this point are really leading into this implementation of how we can go forward fiscally. You can move forward to the next slide, Laura. Fiscally, programmatically, we really are looking at, as we implement, looking at all these programs with the lens of long-term sustainability. Do we have the diversification of revenues? Do we have the program implementation and the program components correct so that we are producing the outcomes that we want? We're going to be looking regularly at these data-driven information from all of the programs in terms of outcomes, fiscal viabilities, and then really looking at expanding, particularly in behavioral health and housing. And really the goal over this implementation year of 2025 is to improve and expand our programs, ensure that they're stable over the long term so that we can continue to serve our mission and serve as many people as possible as we move forward. I did want to give you some highlights of some things that we'll see happening. If you can move to the next slide, Laura, things that we'll see happening in the very near term, in the very first quarter of next year. One of the things that's very exciting is we have already started to diversify the referral and funding sources for our medical respite. We entered into a contract just this week with Carondelet to ensure some bed days. We entered into a partnership with Primavera Foundation so that we can help serve their medically compromised members in our medical respite, and then they can help us with some transitional housing to ensure that we're discharging those members into a safe and stable environment. With immigration, I'll talk about behavioral health last because it's got a lot going on. Immigration and it should say MRS. We have entered into a grant. Hopefully, we're looking at a grant with USCCB to help with the unaccompanied minor population as we move forward into next year. We also are meeting pretty regularly to strategize how we're going to aid any of our members that will be impacted by the new administration's immigration strategy. That's been a focus in a lot of the statewide groups that I've been on, in addition to here at the diocese. And we're really planning on how we can help those populations as needed with information, with support, and with services. Vehicle maintenance, I know that Lucas has been around to all of the programs in the last month or so, really looking at all our cars, getting really good inspections, knowing where all of our vehicles are and how they're performing. And so one of my big goals over the next couple months is to really solidify a centralized strategy for vehicle maintenance so that we ensure our cars are always working, that you guys are always safe as we transport clients and as we use those cars throughout our state. Behavioral health. We really do have a lot going on. We did just recently, again this week, our OTC license should be reinstated, which allows us to expand our behavioral health services. We have been limited to only providing group and individual therapies. This allows us to expand our services and get reimbursed for a lot of the things that we're already doing, such as life skills, case management, peer support. And so it'll allow us to expand and get reimbursed for a lot of the services that we're doing, and then help us treat our members even more thoroughly with some wraparound services. And those are those ancillary services. That's really that case management, life skills, voc and rehab, employment. So we'll be able to expand those in all of our programs. One of the big goals of the behavioral health program is that it goes across our entire service, that we can support housing, we can support child welfare, we can support voc rehab, we can support all of our services with our behavioral health, either through individual therapies, family therapies, or these ancillary services. With that in mind, one of the big things we want to expand is our service to the deaf and deafblind community. We are in a unique position to increase those therapeutic services and support services to that community. So as we move forward, really be looking at how we can maximize Medicaid billing, and also for statewide grants that allow us to expand those services. And then finally, we did just sign a grant
Are you
with
guys in the meeting?
DC USA to serve pregnant women. The goal of this program is to allow us to provide stability, both fiscally and housing, with these pregnant women who may need support. It allows us to also be involved in a nationwide cohort of individuals who will also be starting this program, and we can talk with them about evidence-based practices, what's working in their communities, and we can implement those in our communities. In addition to, it allows us to send our staff to some trainings from nationwide consultants, and allows us to use their curriculum. So I'm really excited about the opportunities, because what we get trained on, again, will be training on employment services, effective case management. It's not just that we could use it for that program, we could then expand it and use it throughout all of our programs as we get trained and get those curriculums. So I think it's going to be a very exciting year. This is just, again, the things that are going to happen in the first few months of next year. There'll be a lot, and through these webinars, hopefully we'll get a chance to update you regularly. There's going to be a lot of exciting new things that are going to be occurring through 2025 as we implement all of the strategies that we've been talking about. I don't know, Elena, if you think I missed anything.
I think you covered it all, Terry. Thank you so very much. Thank you, Lindsay and Julie. And my gosh, I'm just so incredibly impressed and so grateful to each and every one of you. What a year that we've had, and what an incredible year that we will have in 2025. So everything we spoke about, let's definitely celebrate these successes. And let's remember that this is a time for reflection, a time to cherish moments with family and friends. I want to take a moment to also recognize and deeply appreciate those of you who will be sharing your holidays with our clients, ensuring that they too experience that warmth and joy of this special season. And your dedication to our mission brings love and care to individuals, families, and children who might otherwise feel forgotten. And I want to thank you for everything that you do. I want to thank you for your support and wish you a very Merry Christmas and happy holiday season to all of you. I know we have a few more minutes open for questions, comments. Would love to hear from you. Thank you, Tammy.
this is Laura. I have a question. How many employees do we have right now at CCS? What's our staff?
Sure. So we have close to about 300 employees right now.
Okay.
Thanks, Sophia. Absolutely. Thank you, Deb.
I just want to thank everybody for their work and wish everybody a Merry Christmas and a lot of blessings for 2025.
Thank you
Thank you,
so
Elena.
much. Love all the comments. It's super exciting. I'll be seeing many of you at many of these holiday Christmas celebrations that we have throughout the organization. So I very much look forward to seeing you, celebrating with you. And thank you again for everything that you do. It's been such a pleasure. And let's just get ready for 2025, right? Thanks, Sam. And Merry Christmas to you, Laura. Thank you, everyone. Have a great rest of your day. Bye-bye.
Thank you, guys.